You work with Windows, Xbox, Office 365. And after that, now you left that. And then you, I think, went for a little bit in venture capital.
I think my exposure to starting companies, I had my grandfather as an inspiration.
In the last 5 years, especially, was there any an exciting breakthrough?
Two stories that come to mind that really are, there's so many. Manjaro was Eli Lilly challenger, and we produced the very first study that compared the two of them head to head, which results in greater weight loss.
What makes, Truvetta's data different from, let's say, what others are?
I can't speak for what others are offering, but what differentiates Truvetta is that
You're also seeing more competitors coming up because everybody's now AI-enabled tools coming up to the market.
I don't really think I've seen new competitors per se. This is hard work to build trust through.
What's your perspective when you see a headline that AI will replace the doctor? Hello and welcome to the Uprising Show. And today I have another special guest with me, Terry from Truvetta. Terry, just a minute for you to give a brief introduction by yourself before we dive into your journey.
Well, I'm Terry Myerson, CEO of Truvetta. Shorter than a minute, but I think we're about to talk about Truvetta, so I won't elaborate.
Right. Yeah. So once again, welcome. But before we discuss everything about Truvetta, let's rewind a bit and go back to your own journey, where you were born and raised, and really, was either of your parents were entrepreneurs? How did you get the entrepreneurship bug, I say?
Well, I grew up in Daytona Beach, Florida, and made my way north from there. Made my way to Duke University, graduated, and started my career. Made my way to Washington, D.C., into the Bay Area, and then up to Seattle almost 30 years ago. And I've been here ever since. The entrepreneurial bug, my father was a doctor. He passed away when I was quite young. I think my interest in medicine definitely comes from him. But my grandfather on my mother's side was an entrepreneur. He had never went to college, got a spring manufacturing machine out of a landfill and started manufacturing springs and turned it into the Bristol Spring Manufacturing Company. That was, a small, great local business, but it was very inspirational to me growing up that he had his own company and they made a lot of springs, a lot of work for hire projects, but that was exciting to see the pride he had in it and the craftsmanship that went into all things about the company. And, he's now passed away as well, but definitely I think looking backwards, the medicine, the entrepreneurship, I think comes from family.
And he was also running this business in Florida or somewhere else?
Bristol, Connecticut was where the Bristol Spring Manufacturing Company was. When by the time I was a teenager and he was a retired grandpa, he was in Florida, but the company, has since sold, and I actually don't know. I don't know the current status of the Bristol Spring Manufacturing Company. I should go look that up.
Yeah, why not? Cool. And then, I read that you had 21 years at Microsoft. That's by no means no means a small feat. And you've been probably part of everything there, most iconic products. You work with Windows, Xbox, Office 365. And after that, now you left that, and then you, I think, went for a little bit in venture capital. And so walk us through this journey, right? Because it's always interesting when you see somebody who spent almost 2 decades and then says you know what, I'm going to take entrepreneurial route now, and also maybe even VC before that. So how was that transition? And then what were you really what was going on in your mind? What was the question you were asking yourself?
Well, I think my exposure to starting companies, I had my grandfather as an inspiration, but then, in the mid 90s, I was very inspired by the internet. I'd started a company with some friends, which Microsoft acquired. That's what brought me into Microsoft in 96, 97. And then when I left Microsoft, I was spending time with the Madrona Venture Group. So I saw entrepreneurship again from inside of Madrona. But I never thought I would start another company. But you really got to rewind. The founding of Truvetta was such a special and unique moment. You really got to reflect back to spring 2020 and how afraid of the unknowns. Vaccines are going to be 5 years away. Best case, we had mobile morgues on the streets of New York City. All of our kids were home from school. I have three kids, and they were all home from school. And will they ever go back to school? What is going on? on, we started having all of these meetings online and like trying to do work remotely that would kind of worked in a surprisingly good way. But it was in that environment that Truvetta got started, where I built the energy to said, I have to do this. We have to do this. The founders of Truvetta, the world needs us to pull together this data set so we can reason. You'd be watching television, you'd be hearing about infections are way up, deaths are down. We assume it's because young people are now getting infected. We don't know why. We'd have the leader of the World Health Organization and President Trump debating, is hydroxychloroquine a cure for COVID? And they'd be debating this over Twitter, citing different studies. But this should be a data-driven thing. Like people that received hydroxychloroquine after being infected, did they recover faster? And there was no data available that could be trusted or inspected by everyone. And so it was in that environment where it was like, the world needs an answer. The world needs to be able to answer these things, that Truvetta was created. And so it wasn't a very ordinary situation of sitting around with some friends over dinner and saying, hey, let's start a company, or an itch that had to be scratched in my career to start a company. It really was. And the idea of Truvetta certainly wasn't mine. It was an idea that was bouncing around amongst several health systems. Our chairman, Rod Huckman, I think, first and foremost in my mind, came from Providence Healthcare, and they had this idea that healthcare data could be brought together and made into this incredible intelligence asset for taking better care of patients, but make the industry work better. But it was an incredible idea. And so you had this incredible moment of this pandemic. And unless you were there in the midst, you have to like really step back to what were you thinking in April, May 2020, March, when your kids were sent home from school. They're, wipe off your Amazon packages before you open them, wear a mask to the grocery store. What is a mask? I mean, all of that first time things. There was a pandemic in the early 1900s. I had no idea there was a pandemic in 1900s. All of those things. It was in that moment that we're creating the company, and it was just inspirational. It was a way to contribute. It was a way to help out. It was a way to try and have an impact. And then, of course, we're now well beyond that, thanks to incredible innovation in the life science industry and healthcare leaders around the world. But those moments it was in that poignant moment. So it's like, it's not a normal situation. It's not like, I'm going to work for almost 22 years at Microsoft and then go to start a company with a couple friends. No. This was a very unique moment in time, very unique spark. And then once you get in it, you fall in love with it. I mean, I fall in love with the mission we have of saving lives with data. I fall in love with the people I work with. I fall in love with the customers and what they're trying to do. And it becomes a passion project. But no, the creation moment was those 6 months from like March to September 2020, when you're debating, are we really going to do this? Are we really going to do this? Are we really, really, really going to do this? Those were pretty unique moments in human history.
Yeah, and I remember it because I was living in New York City. Now I live in Pittsburgh. But my first child was born on the day when there was the most deaths in New York City. So it was March 30th. And at one point in time, they were even saying that you can't even go in the hospital with your partners. Imagine that. So we were living through that. And once we got there, we were not allowed to get out until the baby was born. So
I mean, it's just you got to like go back to those moments and say, there's this idea of Truvetta, and it's going to have this positive impact on, if we can make it work, it's really going to have a positive impact on the world. And in some ways, the decision then becomes not, should we do this, but why shouldn't we do it? Like, we have to do this. It became our mission. If you talk to Jay, our CTO, or Ryan, our chief medical officer, it really became the mission. We have to do this.
Can you walk or talk through, just so everyone understand, what is the core offering that Truvetta brings to the market, and who's like buying your product or service? How it exactly works? Can you walk through that?
So we have a group of 30 healthcare systems we call our members. Those members contribute de-identified data of their daily care. So all of the procedures, medications, diagnoses that are taking place within their systems on a daily basis, they're de-identified. So this is anonymous information, and we're bringing it together and cleaning it up so we can do healthcare research. Our customers include the CDC to track infectious diseases across the country, pharmaceutical companies that are trying to understand the safety and effectiveness of their drugs. We have pure research organizations from Duke University to Johns Hopkins to Stanford doing research, published research. And that's the core of the business today. But the data is being used within the healthcare systems themselves. The data is being used within the life science industry to really understand safety and effectiveness, which then goes into all of their research and development, how they can produce medical education to inform people on when to use these medications or not use these medications, helps insurers to understand like this innovation impacts the total cost of care in a certain situation versus others. And so we should price a certain reimburse or price an innovation at a certain level. And so that's the core cycle, is the take data from healthcare systems, anonymize it, bring it together so we can really have it at scale, look at really precise cohorts and precise situations, and then payers, life science industry, public health, researchers then use that data to advance medicine.
Yeah. And applications is like there's so many applications of this, right? You can go in many different directions with this right now. But more technically, on the technical aspect, is it more like an API that goes and connects with these systems, the participating systems EHR, then aggregate it, and then kind of create that without, of course, masking it, and then make it ready for everyone to use it? That's kind of how it works.
Well, if you want to get into technology, we should have our CTO, Jay Nanduri, on. But there is a data warehouse, conceptual data warehouse at our member health systems. We're running an ETL process to bring that data to Truvetta, de-identify it. De-identifying is even much more than masking. We have to redact data and remove fields, especially things related to location and time, to really make it, incredibly challenging to try and figure out, approaching impossible to determine who any individual patient is. And then we deposit that data in our own cloud system. We create a interface we call Truvetta Studio, which is a tool to do health economics and outcomes research. So you're defining populations of patients, are running statistics against those populations, you're creating data visualizations against those populations, or you're taking those populations out into your own Snowflake or Databricks or Microsoft Fabric environment. But, for this really hardcore health economics and outcomes research or safety research, we're building a fit for purpose tool to do that, which sort of, maximizes utility and protects the data. So that's the offering end to end today. This very industry specific ETL process, which has a little bit of batch and a little bit of on demand, comes in, de-identification, deposits, and gets indexed so we can then come through later and search it and find new populations of patients, and then do statistics, create studies. So it's an end-to-end system. I mean, one of the unique things about Truvetta for this industry is we really have an end-to-end integrated solution. So you don't have to go piece and parts together. You don't have to find multiple health systems to work with. You don't have to find de-identification software. You don't have to find analytics software. You don't have to find data warehousing things. We're kind of bringing you this interface to do health economics and outcomes research. Of course, if you only want to use pieces of our system, we can do that too. But really bringing that health economics and outcomes research tool directly to the customer is one of our big differentiators in our space.
Is it, or has it gotten easier for you to now bring more health system into your collectives to be participating?
It's always getting easier, but I would love every health system in the world to benefit from this intelligence. And we don't yet have that scalability and efficiency, but I sure would love to get there. Right now, we have 30, these are 30 of the largest health systems in the country. They provide 18% of the daily care across the whole country every day. So it's a very large amount of data, which, is being de-identified and brought together. But it's not 100% and it's all US. So I think to really achieve the vision or the mission we're trying to achieve of really using data in all aspects of the medical industry, we need to really scale that up even farther, which requires, even more efficiency. It's just hardcore data engineering, by the incredible Truvetta team. It's just really, it's a lot of innovation, but it's just nothing. There's nothing like rolling up your sleeves and getting to work and writing good software.
Yeah. I love that you're kind of building the data ecosystem, data fabric for healthcare. And that's where it's, and more countries can benefit from that, hopefully,
I
at a
hope so.
global level. Yeah. So, but while in last 5 years, especially, was there any an exciting breakthrough that you've seen that your platform enabled and you were like, you know what, I didn't think that, but this is amazing and this has an impact on the bedside, something you can recall?
Gosh, I mean, the two stories that come to mind that really are, I mean, there's so many, but we were humbled and so honored, when Pfizer reached out to us in 2022 to actually help monitor safety of the pediatric COVID vaccine, this vaccine that my kids were going to take. And then the fact that they would be using our data as one of their data sources to inform their safety work was just an incredible honor. Because again, goes back to that COVID moment. I mean, Pfizer had such a leadership role to get us through that, and we could be part of that journey with them was just incredibly humbling and honored. Another example that, the other end, I think, of the spectrum, I think, I don't recall how long ago this is, but, there was Ozempic and Mounjaro, and everyone was talking about Ozempic, and, Mounjaro was this Eli Lilly challenger. And we produced the very first study that compared the two of them head to head, which results in greater weight loss. And there was a clinical trial that was running in parallel, but I think about 18 months before it was done, we studied the data and saw that Mounjaro was resulting in higher weight loss. And, it was so consumer relevant. Here was this scientific paper that was published in JAMA, but the fact that it was picked up on the Today Show was, quite humbling. You just see the impact on people's lives you can have, whether it's the pediatric COVID vaccine or, weight loss, which so many people, including myself, need to, it's
Yeah.
on your mind. And so to have that impact on society is just incredibly humbling. And there's more, but those the first two that come to mind.
No, these are great. I mean, these are huge examples of impact, to put modestly. So of course, you've been in this now building for 5 years or more even. There is a lot of buzz in healthcare about real world evidence and regulatory grade data. There's other companies also building it in the space. You probably know them. Well, what does that really mean? Like, what makes Truvetta's data different from, let's say, what others are offering?
I can't speak for what others are offering, but I mean, what differentiates Truvetta is we have this data set that's representative of the diversity of the United States. It's complete from genomics to imaging to clinical notes to data. It's timely. It's updated every day. It's regulatory grade, with full provenance back to the data, with quality management systems to document the data end to end so it can be used in regulatory filings to FDA and CMS. It's integrated into a solution that, starts with ETL and goes all the way to the health economics and outcomes research, tool. And really no one else offers as complete and high quality a data set integrated end to end, through the research tooling and solutions. And so, there's people that offer piece parts. They might offer data. They may offer a tool. They may offer images, but not the rest of the data. They may offer genomics, but not the rest of the data. So having a complete solution that can go, you can log in and start doing the health economics and outcomes research you want to do. It's very unique. And that's what's allowed us to really delight customers so far.
And now that there's more, AI maturity on all fronts, even on the engineering side too, are you seeing more, I would say, engineering productivity gains in your organization? And are you also seeing more competitors coming up because everybody's now AI-enabled tools coming up to the market? How are you seeing on your end internally, and also outside? Is it increasing competition?
So we've bought the best AI tools we can for our developers, but more than, our whole team. I mean, I get so much productivity out of these tools and I'm not writing a lot of code. And so we're buying all these tools internally. I just believe in the productivity increase internally. On the competitive front, I don't really think I've seen new competitors per se. I mean, this is hard work to build trust with you really got to build trust through really high quality processes in engineering on all sides. Medicine's a very serious business. I mean, this is people's lives. And so it doesn't lean itself to let's hack something together quickly. It requires, I think, to get taken seriously in this industry, it requires serious implementations with serious multi-year efforts. I'm not saying there might not be something coming I don't know about, but I think this AI technology is amazing. I can't wait to see it influence our products, what we can do with our team. But yeah, it's exciting time, very exciting time.
Yeah. Anything, I guess, what's your perspective when you see a headline that AI will replace the doctor?
I think everyone's role is going to change. I mean, I think, what does a marketer do today in terms of like writing a press release? Press release is going to get drafted by the AI, but there's still all this judgment about what is the right way to, from a marketer, influence the customer. If you're an engineer, the AI can draft the code, but there's judgment as to how the building blocks compose together into a solution. If you're a doctor, again, I think not knowledge of what's been done previously, Truvetta and AI is going to bring to the surface, but you're still in front of a human to human connection and making a judgment. What should I recommend to Vivek? So I think everyone's role is going to change. It's hard to predict exactly how, but I'm not one of those people that believes we're all going to be sitting on the beach and the robots are going to be doing all the work for us. I have a hard time. I mean, I saw that Elon Musk quote again the other day, and I'm like, I just don't. It doesn't feel imminent to me, but 20 years from now, maybe.
Yeah.
At the rate that we're going right now, not 3 to 5 years. So you and I are still going to be working.
Yeah, yeah. So this is more of just to understand a little bit on your data side, right? Like, because you are a data company, there's going to be a ton of more data coming in the future as you're growing. Are you going to be also kind of now, I guess, competing with other AI companies who also need data centers their own? You also need that kind of infrastructure for yourself, or it's going to be more like using their data center? How your engineering works
For
or
data
data center?
centers, I mean, we're partnered with Microsoft. Microsoft's been a fantastic partner for us at
Yeah,
the infrastructure as a service, compute storage, all those things. They've just been terrific. And so we have we build a lot of stuff ourselves, but like we're just totally hardcore focused on Microsoft. We believe in their innovation, believe in their quality, the character of the company. It's good. So I guess we're competing with GPUs, but like the
yeah.
scale you hear about like OpenAI's GPU usage and things like that. We're a fly on the elephant compared to that.
Yeah, yeah. And I know, company has grown to almost 500 employees now. What's like the next few years looking for you? Like looking into, let's say, 5 to 10 years out, how do you envision Truvetta's role in shaping the future of healthcare? What's the moonshot, I guess, you're quietly
I
chasing, I
mean, I
guess?
think the big question slash opportunity for us is today we deliver the highest quality data and these tools to acquire the data. Can we deliver intelligence? Can we be, we've all seen this now, incredible tools like ChatGPT, which in my mind, they really deliver intelligence to you. You're not just saying like Google gave me 100 articles to comb through myself, but ChatGPT comes through those and summarizes them, distills them, focuses me on the right things. And with our unique data set, can we deliver comparable intelligence to all the people that would be interested in it? So to me, is that the moonshot or that's just something we have to do? So we can call it a moonshot, but we got to land on the moon. Because to me, for us to deliver the potential of our mission, we have to do that. And so that's what we're super focused on.
Fantastic. Yeah. And on what stage you are at in terms of, are you still planning to do a new raise, or you're set for a few years and moving around?
We're always open for discussion, but we're not, there's nothing imminent to announce.
Yeah, yeah. I say so because this is VC favorite show too. So venture capital who are listening, here is Terry. Here's a call to action for you all. So that's what it is. Cool. So you have now, built some iconic consumer products at Microsoft and previously, and now you are really on healthcare. You're trying to build this data platform. I guess how has your leadership evolved, especially philosophy, because you were earlier big part, part of a big organization, and then you are here building from ground up two radically different worlds. So talk about your leadership philosophy. Has that changed or has that evolved?
It must have changed because, I think you're super influenced by the people you work with and the people you work for. But, I've never stopped and written a book on what is my leadership philosophy or what is my management approach. I don't, I've learned from people over time and watched what's worked and what hasn't worked culturally and not culturally. I'm not going to give you a great answer on that because it's not top of mind. Like, I would say that the people I work with at Truvetta they're hardworking, they're smart, they're fun. The people I worked with at Microsoft were hardworking, smart, fun. And I feel like, you work with a pretty consistent group of 10 or 20 people, whether you're at Microsoft in an organization of 10,000 or whether you're at Truvetta with an organization of 400. And there's a lot in common. There's a lot in common between the two, more than I think people would expect. But at the end of the day, you've got your mission, you've got your product, you've got your customer, and your goal is to drive that innovation and delight that customer. There are differences, but I mean, they're in this, we're very US focused versus global. We're very vertical in the healthcare segment versus all segments. But Yeah, it's exciting, fun times.
They say that, especially for folks who have worked at, bigger organizations like Amazon, Microsoft, and then they go into startup world, they are better prepared in a way because they know how actual processes work at larger scale rather than everybody just managing chaos. So have you seen that helped you while, especially now where Truvetta is at this
I
stage?
think it's probably true that, especially, the work Jay does, the lead is our product and engineering teams, just engineering isn't like product, but it's really it's very disciplined and very dialed in and predictable and high quality and scalable. And I just have so much confidence in the work he does. But it's not cheap. I mean, I guess the methods you learn in big tech, especially, I think can be very high quality methods. They can be scalable, secure, reliable, editable, really valuable things when it comes to what we're trying to do at Truvetta. But they are a little more expensive. I mean, I compare it to the Hackery, I had at my first startup in 1994, and that was Hackery, and it's cheaper, but it's none of those other things. It's not reliable, it's not audible, it's not secure, and so to have a partner that's really building auditable, reliable, secure, scalable systems, but they are more expensive than.
Yeah, yeah. I mean, that's a accurate answer. I mean, it's just that we have the luxury to spend more, so innovation can be handled in that way too, right from the
Well,
tool set to the
yeah, I
talent,
mean, we
right?
took the approach at Truvetta to say we're going to do things right. So let's capitalize the company to do things right. And there's opportunities along the way to consider different approaches. But at Truvetta, we've always said let's consider what the investment is going to be required to build this mission critical regulatory infrastructure, for this incredibly personal data. And taking it quite seriously and trying to do the best job we can to bring the mission to life.
Yeah. And of course, goes without saying that, it's not like you're in MarTech. This is healthcare. So it's critical in that way. So you have to reach to that bare minimal at par level to at least make it to the level you want. Yeah. Okay. Well, this has been fantastic. And before I close today's brief conversation, I have a quick fire round, like fun round, just to
Sure,
go
we can
over.
try. Why not? Let's do it.
And so we'll go with that. Okay. Whatever comes to your mind first, that's your answer. Okay.
All right. Okay.
All right. So Satya Nadella or Bill Gates?
I love them both, but Steve Ballmer was the guy I worked for and enjoyed working for. So between the two, I feel like I grew up at Steve Ballmer's Microsoft with Bill Gates there and Satya Nadella as my peer. I mean, I did work for Satya for 5 years, but I'll answer Steve Ballmer.
All right. All right. Cool. It reminds me of Steve Ballmer Energy developers
He's an incredible
on the
man.
stage. Yeah. AI in healthcare, overnight transformation or slow adoption? Where do you see that?
I think it's going to be adopted fast, but the transformation will take time. I
Yeah.
think you got a lot of mission critical systems of people and technology. And, there's actually a Bill Gates quote, I think that's quite relevant, that we overestimate the change in the next 3 years, but dramatically underestimate the change in the next 10. And I think that applies to that answer. It's like, I think it's going to get adopted fast, but the transformation I think is going to take a little bit of time.
Yeah. That's a good one. Yeah. All right. So what is something no one in your professional circles knows about you, but this is kind of your chance to share it, tell the world what would be that thing. Could be anything, whatever you feel
I
you could share.
I don't think there is anything. I feel like I'm not like all my coworkers know me like an open book. So there's nothing to share.
You're not playing some musical instruments that no one knows or
If I
doing some
was, I'd be talking about it. So I was like, I have no secret musical instrument. So no, it's.
Yeah, that's fair. Oh, that's fair. Okay, cool. This has been great. Before we conclude this conversation, if anyone wants to get in touch with you, what's the best way to connect with you?
I think info@truveta.com, info at truveta.com. And, the best person at Truveta to help out. If it's me, it will get to me very quickly. If it's somebody else, you'll get to the right person there. I mean, it's just, but we look forward to hearing from everyone. Anyone who's interested in what we're trying to do with saving lives with data at Truveta.
All right, perfect. Great mission, great company in great position and solving a big problem. So if you are investors, engineers, reach out if you have to. This is a great company. And I'm very positive about this especially after I learned more in this conversation. So looking forward to hopefully getting you back on the show in few months, few years when you are a little bit more ahead in your journey. Thanks again,
Well, thank
Terry.
you, Vivek. Thanks for having me.